Hello and welcome to today's review. Today we shall be looking at the NCK past paper examination. Past paper. This is paper 3. Currently based on today's standards is majorly paper 2. Alright. Let's get right into it. We have question 1. In community diagnosis, background data about the community is collected during. Alright, based on the steps of community diagnosis, background data is majorly collected during the exploration phase. Right, remember planning is all about setting goals, prioritizing health needs, and developing strategies of addressing them. Execution is all about implementing planned interventions, while pretesting is not really a stage of community diagnosis. Question number 2. Demographic data collected during community diagnosis includes, of course, demographic data. We are referring to variables that can describe population structure. So looking at option number 1, age, health facilities. Health facilities may not describe the population. Age, sex, educational facility also will not be able to answer our questions. Health facilities are here. It makes it easier for us to pick up the correct answer. Variables that can easily describe a population includes looking at the age, looking at the sex, and looking at their educational level. Number 3, after dilution, anti-measles vaccine remain potent for how long? All right. I think we have interacted with this one most often. It's normally 6 hours. Remember, after 6 hours, it can lose its efficacy quickly, even when exposed to light or room temperature, right? That makes it easier for us. Number 4, a child should receive the first dose of vitamin A at what age? First dose is usually at 6 months, and vitamin A is very essential for supporting the immune function and reducing the risk of infection at this in this population, right? And you're going to be getting the 100,000 international units. In most cases, it is normally blue in color. Number 5, the method that can be used to test the potency of TT vaccines which have been exposed to freezing conditions is, alright, looking at all this, maybe like the first one, vaccine vial monitor. This is normally heat sensitive label that is placed on a vaccine vial to indicate if the vaccine has been exposed to high temperatures over time. Temperature reading, this is normally will be used to monitor the storage environment to ensure that the temperature is within the normal range, while the vaccine cold chain monitor may not be actually among those. I think the best option for us is option number B, which is called the shake test method. Shake test method is normally used as in the case of tetanus toxoid to find out whether it's frozen. So we have the adjunct in it. So if it's frozen, there will be sedimentation, separation, so that with the sediment, the heavier part and the lighter part, you will be able to see that. And in that case, at least you'll know that the potency of the tetanus toxoid has been lost. Diseases that can spread as a result of poor excreta disposal will include poor excreta, right? I think looking at scabies, this is normally a skin infection that is normally caused by mites. Hepatitis A and cholera, I think this can be examples of diseases caused by poor excreta. On cosacchiasis, we know this is what is normally referred to as river blindness, right? River blindness, and it's normally caused by a bite of by infected black flies. Trachoma is also not in this category of poor excreta. As we know, this one is normally caused by infected eye discharges, right? Trachoma. Looking at option number 6, Schistosomiasis malaria. Malaria is normally a parasite disease caused by infection, bite by mosquito, female Anopheles mosquito that introduces parasites to you, and that will lead to the life cycle of malaria, bringing about the signs and symptoms. So it may not be part of these ones. Of the 4 options, hepatitis A, schistosomiasis caused by Schistoma mansoni, and poliomyelitis, these are examples of them that can be caused or spread as a result of poor excreta disposal. In management, in management of communicable diseases, the term eradication, right? Eradicate means you are totally and permanently reducing the incidence of a disease to 0. That is what we refer to as elimination of a disease. In the life cycle of the malaria parasites, the zygote form is normally found in which stage? When we have the stomach, right? Especially the midgut of the mosquito, right? Remember, for the salivary glands, we will only be talking about the sporocytes, which are the infective stage of the malaria parasites. For the Kupffer cells, we'll be talking about the liver schizons, right? The liver schizons here. Bloodstream, talking about the merozoites and so on. So here, this is where we get it, the correctors. Number 9, the vector of filariasis, right? Filariasis. Remember, Santifly is a vector for leishmaniasis. Rat flea mostly causes plague that is normally caused by Yersinia pestis. Culex mosquito. This is what will be the agent for the filariasis, right? The vector for filariasis. While the vector like black fly will be causing the onchocerca or river blindness because it's caused by the onchocerca volvulus, right? So answer C here is the best option for us. In palliative care nursing, or palliative care nursing for HIV patients, the main objective is, remember the objective about palliative, you are looking at symptom relief and maintaining the patient should be comfortable, right? So this makes the answer B to be the best option. Pre-testing is part of HIV prevention and testing and not palliative. Looking at intensive normally aims at managing or curing disease, and focus in palliative, as we have said, is comfort and not aggressive treatments. D, ensuring continuum of care. This emphasizes this may not be able to really answer the question exactly. Palliative care should focus on comfort and symptom management. We have sore cracked lips that may be due to the deficiency in. Alright, so looking at nicotinic acid, of course, this one normally leads to deficiency of niacin, and deficiency of niacin is normally prevented by symptoms, the 3D symptoms, right? And the D3 stands for, of course, person suffering from pellagra is going to present with dermatitis, diarrhea, and dementia. Thiamine, this is normally going to cause the bear, while the riboflavin is what is going to cause vitamin B2 deficiency. Ascorbic acid will result into this scurvy, that is vitamin C deficiency, that is characterized by bleeding in gums, bruising, and joint pain. Anthropometric measurements used to assess nutritional status in children include, alright, option number A, we have reservations with chest circumference. As you know, this is less commonly used in assessing nutritional status. Option number B, weight, arm circumference, and height. We can even talk of length, right? This one at least could answer our question. Height, That's correct. Head circumference. As you know, head circumference is normally used to assess brain growth in infants and not directly nutritional status. So weight is okay. Option number D, you see temperature. Temperature is not anthropometric measurements. Number 13, management function, which involves arranging for everything to be at the right place at the right time for work to proceed according to the plan, is what you are organizing, right? You are organizing. Remember, planning is all about setting objectives, coordinating, you are ensuring different departments are working in harmony, while controlling involves monitoring and comparing to established standards. So the best option that answer our question is option number D, right? Alright, the term networking means, okay, the best option for us here is people with the same interest working towards a common goal, right? Working towards a common goal, that will be okay. Number 15 is we are looking at the sexually transmitted infection most likely to cause corneal ulceration in newborns. Looking at the options we have, I think gonorrhea is the most likely cause. Of course, in Kenya, we are in the process of eliminating gonorrhea, which are good indicators. But the reason why we pick gonorrhea is because gonorrhea is associated with gonococcal conjunctivitis, and that could explain or answer our questions. Syphilis, I think what is associated with it, you have congenital syphilis, although this one is less associated with corneal ulceration. Trichomoniasis is about vaginal symptoms and not corneal ulceration, and HIV/AIDS is not directly linked to this. Next, we have combined oral contraceptives. Contraceptives primarily prevent pregnancy by, all right, I think the best option for us is option number A. They suppress ovulation, right? And then they do what? They also thicken cervical mucus, mostly the pulp aspect of it, then the changing of the intrauterine lining to prevent implantation. The others do not directly, are not the primary actions of the COX. Maybe a link will be popping up on the COX. You can still look on the family planning. You can try and familiarize yourself with the other types of family planning. Vasectomy is contraindicated in, yeah, the best option for us here is the large hydrocele and inguinal hernia. Remember, diabetes is not an absolute contraindication, while phimosis is not a contraindication, right? Hyperspedia, not a contraindication. Desired family, right? Of course, if you have not achieved the desired family, then there is no need to perform that. Otitis is not a contraindication, right? One of the disorders of perception, right? This is mental health, of course. Perception disorders mostly will be of the hallucination, right? Okay, which could be auditory, visual, and so many others, along with the illusions, also their perception. The type of communication between heads of departments who are at the same level, that's, I think it was easy, that was horizontal communication. Social change refers to the transformation of culture and social institutions over time. And C was the best option for us. Long answer, that is short answer. We have steps of checking gas equipment for leaks in an otherwise e.g. refrigerator. You have to look at safety precautions, visual inspection, use of leak detection solution, smell of the gas, pressure test if it's applicable. Then we have the checking of safety device, repairs and adjustments, final inspection, reconnect and test, and finally documentation. Purposes of a budget, we have financial planning, resource allocation, Performance measurements, control, cost control, decision making, financial accountability, forecasting, communication tool, facilitate funding, and motivation. First three stages of HIV. Of course, the first stage is all about the acute HIV infection, which is referred to as primary HIV infection, followed by the clinical latency stage. This is the chronic HIV infection that is characterized mostly by skin infections. Then number three, we have severe immunosuppressions, where we have AIDS. This stage is normally characterized by occurrence of opportunistic infections or specific cancers. Then we have stage 4, which is advanced HIV AIDS. In summary, you have stage 1, stage 2, stage 3, and stage 4. Six messages a healthcare provider should share with the mother whose child has received an immunization. You talk about importance of immunization, vaccination schedule, possible side effects, when to ask or to seek medical attention, talk about the follow-up visits, a record keeping. Now we have the steps, the steps of counseling in family planning. Of course, when you want to provide or a patient is seeking FP services in your clinic, you normally use gather to counsel your patient. So that G is you greet the patient, you ask about their needs, talk about their options, help them make a choice, explain how to use the chosen method, and then talk about return to follow up. Next, we are looking at problems of the elderly, right? We have several problems of the elderly. Could have the chronic health conditions, cognitive decline, mobility issues, sensory impairments, mental health challenges, nutritional deficiency, social isolation, and financial challenges. State 5 primary health elements added by Kenya government to the list of alma mater declaration. We have community participation, health promotion and disease prevention, integrated health services, essential drugs, intersectoral collaboration, focus on vulnerable population, capacity building and human resource development, sustainable financing. State motor skill development, a child learns at 2 years and at 3 years. So at 2 years, we talk about gross motor skill, that's like running. So at this age, children typically begin to run more confidently. They can move quickly with greater coordinations, which helps them explore the environment more freely. At 3 years, there is development of these fine skills, fine motor skills, so they could draw a circle. So children often develop the ability to use crayons and markers to draw simple shapes such as circles. These skills indicate improving hand-eye coordination and dexterity. The aim of a nutritional program is to promote good nutrition and to eradicate we are eradicating malnutrition, right? This is spelling. Yeah. We are eradicating malnutrition. So define malnutrition, list different kinds of food found in different kinds of nutrients found in food, set 4 factors that promote good nutrition, describe the responsibility of the community nurse in promotion of better nutrition among the under 5s. So malnutrition, of course, is a condition that occurs when an individual diet does not provide adequate nutrients or the right balance of nutrients according to the health problems. It includes both undernutrition, that is deficiency in essential nutrients, and overnutrition, excessive of energy or the nutrients. Different kinds of nutrients found in food. We could have carbohydrates, proteins, fats, vitamins, minerals, and water. Factors that promote good nutrition, we have balanced nutrition, education and awareness, access to healthy foods, healthy cooking practices, Responsibilities as of the community nurse include assessment of nutritional status, educating and counseling, nutritional programs and workshops, coordination, supporting breastfeeding, collaboration with other health professionals, advocating for healthy food environments, monitoring and evaluation to find the effectiveness of nutritional and interventions, community involvement, right, about the nutrition and encourage participation initiatives that promote better food practices, referral to specialized services, promoting hygiene and safe food practices, cultural sensitivity, and continuous professional development. Last question was about tuberculosis. All right. So tuberculosis is one of the re-emerging diseases due to the high prevalence of HIV/AIDS in the society. You are told to state the mode of transmission of tuberculosis, and you state 6 host factors that predispose a person to tuberculosis. You list 6 signs of tuberculosis and discuss preventive and control measures of tuberculosis in the community. Tuberculosis is primarily a disease transmitted through airborne particles. Those are droplet nuclei. When an infected person either coughs, sneezes, talks, or sings. So these tiny droplets can be inhaled by individuals in close proximity, leading to potential infection. Host factors that can predispose a person to tuberculosis. Number one is individuals with compromised immune systems, particularly those with infected with AIDS, are at significantly higher risk of developing active tuberculosis. Equally, poor nutritional status can also weaken the immune system, making individuals more susceptible to infection, including TB. And conditions such as diabetes, chronic lung diseases, kidney disease can also increase the risk of TB. Young children and old adults tend to have weaker immunity, making them more vulnerable to TB infections. Alcoholism, drug abuse, smoking can impair the immune system and increase the likelihood of contracting TB. People who live or work in close quarters with someone who has active TB, be it a family member, healthcare worker, are at a higher risk of exposure. What are some of the signs and symptoms of tuberculosis? We have a cough that lasts more than 3 weeks, often producing sputum, discomfort or pain while coughing or breathing, low-grade fever that may persist, often accompanied by night sweats. You also have unexplained weight loss or loss of appetite, general weakness and fatigue that lasts for an extended family and period, and have coughing of blood or blood-stained sputum in more advanced cases. So what are the preventive and control measures of TB? We do early diagnosis and treatment, right, through community health education, screening programs. This will ensure prompt treatment for those diagnosed with TB to reduce transmission. We also implement the DOT strategy, right? That's directly observed treatment strategy, where community health workers observe patients taking their medication to ensure adherence to the prescribed treatment regimen, preventing the development of drug-resistant TB. We also encourage the BCG, that's the Bacilli calmette guerin vaccination for newborns and high-risk children, which provides some protection against severe forms of TB. Implement infection control practices in healthcare settings, such as proper ventilation, use of masks by healthcare workers, patients, and isolation of infectious cases. You also need to conduct community awareness campaigns about the symptoms of TB, transmission, and the importance of seeking medical attention promptly. So you educate about the stigma associated with the TB to reduce discrimination. You also need to address the social determinants of health by working on improving living conditions, nutrition, and access to healthcare, which are very vital in preventing TB and supporting those at risk. We also need to implement routine screening for TB in high-risk populations, including those living with HIV, the homeless ones, and people in congregate settings, like the prisoners, right? Also enhance healthcare, its healthcare infrastructure and capacity to diagnose and treat TB effectively, thus ensuring that healthcare are well trained in TB management. You also need to establish robust TB surveillance systems to monitor incidence rates, treatment outcomes, drug resistance patterns, in enabling targeted interventions. You also need to promote healthy lifestyle choices such as proper nutrition, physical activity, avoidance of smoking, and excessive alcohol use to boost the immunity. You also need to partner with non-governmental organizations and community groups to reach underserved populations and facilitate access to TB services. And lastly, you need to support research initiatives aimed at developing new vaccines, diagnostic tools, treatments for TB to improve control efforts for the long-term management.